You're listening to the Quint's podcast.
On 28 April, India officially crossed a grim landmark of 2 lakh deaths from COVID 19. However, we may have reached this number a lot earlier than it was announced. The alarming spike in daily cases and fatalities has not only highlighted the weak health infrastructure in the country, but also led to long waiting periods at crematoriums in Delhi, Gujarat, Uttar Pradesh, and several other states. According to the World Health Organization, a death should be recorded as a COVID death if the disease is assumed to have caused or contributed to it, even if the person had a pre existing medical condition or comorbidities. However, there have been reasons to speculate that multiple states in India have been grossly undercounting COVID 19 deaths. So, in today's episode, we will go through several news reports and the Quint's on ground coverage on the ground reality at crematoriums across the country that suggest a discrepancy in COVID 19 death toll figures in India. To help me in this endeavor, for today's episode, I spoke with Poonam Agarwal, Quint's investigations editor, and Ritvik Bhalekar, the Quint's senior correspondent in Mumbai. You're tuned in to The Big Story, the podcast where we dissect the headline making news for you, and I'm your host, Himmat. Let's start with the national capital first, which is witnessing a severe shortage of medical oxygen and hospital beds for the past 2 weeks, whilst reporting thousands and thousands of fresh cases daily. Delhi logged 381 deaths on 27th April, the sixth continuous day of recording over 300 deaths due to COVID. Much like hospitals, crematorium in Delhi have been working around the clock too, and many are being forced to build makeshift funeral pyres as the city runs out of space to cremate its dead. The cumulative figure of COVID deaths released by the Delhi government between 18 to 24th April show 1,938 deaths. However, an investigative report by NDTV uncovered that this number is grossly undercounted by at least 1,158 deaths, as the Municipal Corporation of Delhi MCD data from 26 crematoriums show that 3,096 cremations of COVID victims were carried out in the same period. The report further states that the MCD also does not consider deaths at home that have occurred due to COVID as COVID deaths. Poonam Agarwal, the Quint's investigations editor, travelled to a crematorium in East Delhi's Simapur to understand the ground reality. Here is her ground report.
So, Himmat, yesterday I went on 27th April. I went to Simapuri. I reached around 2 o'clock in the afternoon. So, the aim was to meet one of the social workers, Jitendra Singh Shanti. He is running ambulances for free ambulances, and this is something he's doing for almost over 2 decades. So he has actually set up a small stall over there, help desk, and when I reached there, what I could see was first that non-stop calls on his phone, seeking some sort of help, whether it is ambulance or whether family can bring a body for cremation. Constant call, and it is in East Delhi. Simapuri is in East Delhi. So apart from that, another thing that I witnessed is that the number of ambulances were standing there. Some bodies were lying inside the ambulance, and some body were taken inside. And when I entered crematorium, I could see at least 5 to 6 bodies lying there waiting to be cremated. And at that moment, cremation was on. Many bodies were being cremated in the ground, so there was no space. So these bodies were in the wait list.
Yeah.
And this process was like never ending. Bodies were just coming in throughout the day. I spent there I spent there initially. I spent 1 hour, and after that, I went on shoot with Jitendra Singh Shanti's ambulance to pick body from a residence. They got a call, and then when I came back with the body, actually these people, they are taking bodies from everywhere, whosoever. Sometimes people are able to come, sometimes they are not able to come, family members, because they themselves have quarantine. So they just give the rights to the person, Shanti's seva dal, that you can cremate the bodies, and sometimes people also abandon the body. Nobody comes for their own reasons. This is what he told me. In fact, just 2 days back, he found one body lying outside crematorium since afternoon until 9:30. Nobody came to cremate it. Finally, he had to make police call. So yesterday itself, you know, it was around 105 bodies were cremated till 8:30 in the evening.
Just in the day, just in
In the
one day,
day, in the day,
in the
yes,
day. Okay.
yes. And Jitendra, he also told me that till date, since
Hmm.
10th of April, after 10th of April, the
Hmm.
number of bodies kept increasing,
Okay.
and till now he has picked 100, maximum 115 bodies in a day.
Wow. Okay. Yeah, that is a startling figure as well because
It is.
yeah,
And honestly, like, it was a terrible feeling
yeah,
being
I can
inside
imagine. Yeah.
a crematorium. The crematorium was full, and they actually occupied a small land, open land, just behind the walls of crematorium, where they were cremating bodies. And it was terrible. Family members who were there, they were just sitting and waiting. They were very patient
Yeah.
because they knew the situation. Nobody was rushing. In fact, some of them were helping people to carry, woods till the
Hmm.
pyre.
Yeah.
That kind of help was being given constantly. There were, people coming forward to help each other.
Hmm.
And, you know people were really cooperating with everybody. There
Yeah.
was no rush. They were maintaining peace, and also, the order. And what
Hmm.
Jitendra Singh Shanti told me, that the situation is so bad, all he wants that people should come forward to help as much possible,
Hmm.
because his team, among team members, so far three have tested positive. One person died,
Wow.
and not in this wave, but in the last first wave, during giving
Hmm.
service in the first wave. And one person is currently in ICU.
Wow.
What was very shocking to me was, one of Shanti's drivers. He runs ambulance, he drives ambulance, and the helper, one of the helpers, he's a volunteer. He just joined Jitendra Singh Shanti's camp 3 days ago. Because of the lockdown, he there is no business, he doesn't have any work. What he does, he just help them. He goes with the ambulance, pick dead bodies from residents, and bring it to crematorium for free. He is not even charging. He told me that he has been to places where family members, they don't even want to touch the body, and he was really disheartened for that. He said that, what if we can touch, we are no one to the person, why can't family members? So this is a big service.
Yeah.
And this is, I'm talking about just one crematorium.
That's one. Yeah. That's what also what I want to highlight is that you yourself have witnessed 105 cremations, as you reported as well. And Delhi on 27th April logged around 381 deaths in total.
Yeah.
105 are coming from just one crematorium in East Delhi. I'm sure the numbers are a lot more startling.
Of course,
Yeah.
because Jitendra, he told me that the calculation done by the administration
Hmm.
is totally different. According to Jitendra, if 90% bodies are COVID bodies, but
Hmm.
administration is saying that only 50 to 60% are COVID bodies. And he has explained in his bite why
Hmm.
this cannot be true, because in a day, maximum 5 to 7 bodies are cremated in
Hmm.
Simapuri. When it has shot up to, say, around 105, 120,
Hmm.
how will you explain that then? So definitely the numbers shown by the administration, Delhi government, doesn't seem to be true.
There is one number that may help you visualize the scale of COVID deaths in Delhi. According to a Hindustan Times report, before the second wave hit, Nigambodh Ghat, which is Delhi's largest and oldest cremation ground, required 6 to 8,000 kg of wood daily. But this requirement has now risen to 80,000 to 90,000 kg of wood daily. The death count in Delhi has increased to such an extent where crematoriums are now running out of wood and are seeking help from the State Forest Department. Let's now move to Delhi's neighbor in the east, Uttar Pradesh, where the situation of undercounting deaths is eye-opening to say the least, especially in the cities of Kanpur and Lucknow. In Lucknow, government official data states that the city only reported 39 deaths on 27th April. However, according to an India Today report, the Bekhun Dham crematorium cremated 60 COVID patients on that day. Worrying scenes of endless funeral fires are also being witnessed in Lucknow, where reports of discrepancy in COVID deaths prompted an odd response from the government on 15th April, which was blocking the view of the pyres with blue tin sheets. In a video widely shared on social media, workers can be seen erecting a wall using metal sheets, often used for construction, outside a cremation ground in Lucknow. The figures are more alarming in the Kanpur Nagar district, where, according to official government figures from 19th to 24th April, the district reported only 66 COVID deaths. However, a PTI report dated 25th April states that 406 cremations took place at the Bhairo Ghat crematorium and 56 at the Bhagwat Ghat crematorium. 91 of these cremations in the former were performed on 21st April. Let's move to the western part of India, where a similar crisis of discrepancy in COVID death figures is being witnessed in Gujarat, especially in the city of Surat. Crematoriums in Surat are being overrun with COVID patients to the extent where the bodies of 5 COVID patients were cremated on a single funeral pyre on 14th April. According to a report by the Times of India dated 16th April, at least 180 people had died in COVID ICUs at Gujarat's SSG hospital in the previous 9 days, while the number of deaths in COVID ICUs in GMERS Medical College and Hospital in Gothri had reached 115 since 7th April. Combining these two government-run hospitals' data, the death toll was seen to be close to 350 in a week. However, official government figures put the total death toll of the pandemic in the entire Vadodara district at 300 since the outbreak of the pandemic last year. And Gujarat Chief Minister Vijay Rupani stands by the government's death toll figures and has stated that the government is not hiding any COVID fatalities. Finally, we move to Maharashtra, the worst hit state by the virus, which on 28th April reported 66,358 fresh cases of COVID and a record 895 new COVID-19 deaths. Mumbai, one of the major hotspots in the state, reported 4,014 new cases on Tuesday and has been witnessing a steady uptick of deaths since the start of April, from 18 deaths reported on 1st April to 54 on 14th April and 59 on 28th April. To understand the ground reality of COVID deaths and crematoriums in Mumbai, the Quint senior correspondent Ritvik Bhalekar traveled to 3 crematoriums in the city today. Here is Ritvik's report.
So basically, I've been to 3 crematoriums in Mumbai. One in South Mumbai, which is in Worli. Second one was in the middle of the Mumbai, and third one was in the eastern suburbs, that is in Ghatkopar. So Worli being the very first hotspot in Mumbai, and there are 3 to 4 different big hospitals in that area. So basically, the number of dead bodies coming over to Worli crematorium was much larger in the first wave, and same was the situation 10 to 12 days before. But when I spoke to the workers there, they told me that the situation is much under control now, because maybe there's a coordination between hospitals and the workers who are working there, the BMC officials, and also the police. So what they are doing is they are coordinating in a way that वहाँ पर कतार नहीं लगे dead bodies की.
There are no lines as such over there.
Yes. तो जब भी कोई डेथ होती है कोविड की किसी भी हॉस्पिटल में, तो वहाँ पर वो पुलिस को इन्फॉर्म करते हैं, लोकल पुलिस स्टेशन को, और जो लोकल वार्ड बीएमसी ऑफिशियल जो है अथॉरिटी, उनको इन्फॉर्म किया जाता है. और अकॉर्डिंगली वो टाइम स्लॉट्स देते हैं या तो टोकन देते हैं. और कोविड की बॉडी तभी हॉस्पिटल से निकलती है जब क्रेमेटोरियम में जो बॉडी जिसके ऊपर दाह संस्कार हो रहे हो वो पूरा हो जाए. बेसिकली एक बॉडी को सारा विधि करने के लिए कम से कम 2 घंटे लगते, इलेक्ट्रिकल फर्नेस अगर हो तो, और अगर फायर हो, लकड़े पर बॉडी जलानी हो तो उसको 2 घंटे लगते. ये हमें वहाँ के वर्कर्स ने बताया.
Yeah, I just wanted to get some facts. Like what you're saying also correct is that there's a proper process which is followed if a body needs to be cremated in Mumbai, where it has to be registered with the civic bodies of BMC, and there are no lines as such. And in electric crematoriums, the cremation is around 2 hours, and for wood fire crematoriums, it's around 2 to 3 hours or a bit more.
3 to 3 hours, 3
Yes.
to 3.5 hours.
Okay.
Yeah, it is more. So there were 10 to 12 bodies in a normal time which were coming to the crematorium, which included 4 to 5 COVID bodies. So now the number has gone to 16, but still because of the coordination between all the authorities, we can see that there's not much of a mess over there.
Okay.
Like we are seeing it in Delhi or maybe Kanpur or other places in the country. So yeah, this is how it is happening in Mumbai.
Okay.
People are they are in pain. They still are struggling with so many things. But जैसे बेड के लिए या ऑक्सीजन के लिए जैसे किल्लत है और जिस वजह से लोग मर रहे हैं, और एट द एंड देखा जाए तो उन्हें एक जगह भी नसीब नहीं हो रही है जहाँ पर उनका अंत्य विधि हो, अंत्य संस्कार हो. तो उस तरह की सिचुएशन फिलहाल तो मुंबई में इन तीनों भी क्रेमेटोरियम में फॉर्चुनेटली मैं कहूँगा नहीं देखने को मिली. और अगर कहा जाए the workers, the number of workers who are working in 3 different shifts, they are also not that much worked up because of the obviously the coordination which they are having with the concerned authorities.
Yeah, so basically the things that we're witnessing in Delhi and Uttar Pradesh as well, states like these where there's a shortage of beds, ICU beds, oxygen, medical oxygen specifically, is not being witnessed in cities like Mumbai and Pune, where there are deaths due to COVID, but they're not exacerbated or heightened because of the lack of ICU beds and medical oxygen. And this, in some ways, has also helped the cremation, the workers at the cremation grounds as well to not be overworked or overburdened as what we have reported in Delhi and Uttar Pradesh, specifically Kanpur, Lucknow, and Gujarat also, right?
Yeah. Lastly, I would like to mention the one demand which one of the worker in the crematorium came up with, and I think which is very important and should be thought about, which no one has yet spoken about. I'm very surprised. Is that he was demanding that we are also the frontline workers and we are most exposed to all the COVID bodies. So government should think of it that we should also get vaccinated as a frontline worker.
Yes.
And there should be priority, and government should think about it and act upon it. So I think it is very important. This demand is very, very important.
Yeah, it's also very legitimate, like seeing how many deaths and cremations are being done in every cremation ground is startling that they're not considered as frontline workers. Yeah, so it's very rightly said also, as you mentioned. Maharashtra, Delhi, Uttar Pradesh are among the 10 states in India which account for 78.53% of new COVID deaths reported in the past 24 hours. According to the Ministry of Health, 3,293 people lost their lives in the past 24 hours to the virus, the highest single-day count so far, pushing the total death toll in the country to 2,01,187. But the question remains, what is the actual figure? Experts at IHME in Seattle, Washington have projected that estimated deaths in India due to the virus till 1st August 2021 will be 9,59,561. However, this number is based on official figures, trends, and variables such as smooth vaccination distribution in the coming 90 days. If you want to read more on coronavirus, vaccinations, and treatments, head over to the Quint's website for our detailed coverage on the virus. Till then, mask up when you step out, maintain social distancing, and stay safe. If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.